this is Hassan Sadri here at OIS AAO 2019. I'm here with my good friend Laurent from Alcon. We're just talking about cars. We love cars, but we're excited because there's so many things you've done, and we saw each other at ASCRS San Diego. There's so many amazing things you've done with your crew, with Honest Check. Too bad he's not here. I would have made fun of him a little bit. Tell us what's hot right now. What's on your plate? You had a monstrous year last year.
Yes.
So is it going to be difficult to match that in 2020? Tell me.
Actually, thank you for having me, first of all. But I think we're on a good track even this year, and you'll be surprised. But we're probably on pace with last year, actually.
Wow.
And the last quarter seems to always be kind of a rush anyway, so we see what happens. I think more importantly, we're not going for the number, obviously. We're going more for the types of areas that we want to enter. We like the things that are going on in presbyopia. We like the things that are going on in dry eye. We like the things that are going on with some of the drug delivery that we're hearing here, because we're a device company, and therefore we would love to be able to leverage our skill set in the OR and how we work with you, the physician, to partner and to enable new ways to manage a particular disease. I think there are a lot of diseases in ophthalmology that are ripe for new management. I mean, we saw it a few years now back with the glaucoma, changing into a surgical approach, minimally invasive. So we're all about that, thinking about diseases and how they can be transformed a little bit. And this meeting obviously offers us a view on that.
Yeah, I mean it's amazing. I think so much of success, and you can correct me if it's wrong, is people, leadership, right? So you get Alcon, and now I just feel like it's a different company since you spun off. Nothing against anybody. I just feel like you have focus. We talked about that a little bit, and drive. And internally, I feel like you're just moving a lot faster. As a company this size, with all the things you're interested in, how do you allocate internally some of the sort of prioritize? Take the war room mentality. How do you do that?
So
it's interesting.
Look, I'm very proud of the team actually that we built over the last 3-4 years. But what we also designed actually from the grounds up, locking ourselves in a hotel room back 4 years ago, is an internal process that is pretty structured and regimented to avoid any kind of undue work and things that will never meet our priorities, and therefore you spin the organization in doing too much work. Also, a process that allows us to have cross-functional alignment and escalate things so that we can either quickly elevate things or quickly kill things, because that's equally important.
Sure.
That you don't spin on things that are actually not. Now, when you said about priorities, believe it or not, in working with the commercial franchise that you mentioned, Michael Honishek represents, or even the R&D piece, we are right now in the process of establishing the 2020 priorities for external innovation. And so we follow a menu that we've jointly developed with our commercial team and R&D, and it gives my guys, my team, kind of like the licensing, the hunting license over the kind of categories that we feel are going to contribute to the portfolio of Alcon. I've mentioned several times now, and hopefully our actions and our decisions have proved it. We're agnostic to where innovation comes from, and so by following that priority list, we're complementing R&D's current projects, or we're adding new skills, or enhancing current programs. So that's how we do it. We have a nice process. We have a governance that's an escalating one, and we try to obey by it.
So that's interesting, because so what I'm hearing is you've got an agnostic view on where technology comes from, so there's no tension between because there's always companies.
There used to be.
Yeah,
there used to be. Absolutely.
I remember, internal R&D said, wait a minute, what about me? What about us?
Well, or if it's not made here syndrome.
Correct.
Right.
If it's not made here, it's not by us for us kind of thing. So, and that's, I think, the recipe to your success, keeping that neutrality.
Yes. Neutrality. It also translates in the approach that you take in integrating technologies. We'll not pronounce any names, but I can tell you that I've seen engineers of newly acquired company integrate, and let's say it's some kind of device where you look through, oh no, mine's better than yours. And you had fighting between two engineers, one from Alcon, one from the new company coming in, believing that their same approach to the same objective was better than the other. And the infighting was, we solved for that. We've embraced the people that come in. We've tried to focus on not the ownership of the innovation, but mostly where it's going to fit and who is in the best setup to develop it. And that's why when we look at acquisitions and what stage, we actually try to enter the stage that we believe we can bring value. So if they can develop it technically on their own,
great.
Kudos to them.
Yeah.
We're not going to intervene. If we can help on the regulatory side, then we'll step in there. Or we'll step in earlier at the development side because maybe they'll need our engineering. So we're not deciding where we enter as companies like to do late stage, whatever. No, we're customizing it to whatever skill set comes along with the innovation.
That's hard discipline. It's hard discipline, but kudos to you. And I was telling you earlier, I was fascinated by success. How do you make a baby Laurent into a mature Laurent? So your career path? There's a lot of people looking at our viewers, listeners, because you turn into a podcast. I love having you on because you're so open.
Thank you.
And innovative. What's your career path? Is that learned? Open-mindedness, open-heartedness, if you will?
I think that you
How do you not get dogmatic?
That's right. I think you build your openness by having just a little willingness of trying things that are outside your comfort zone. You also have to remember that a career is not a smooth exponential curve. It's a curve that goes like this, like that, like that. And I can tell you along in my career, for example, I started in pharmaceuticals and then I went to devices. When I went to devices, I took 2 title drops so I was a director, I became a product manager again. Didn't matter. What mattered was the experience. I volunteered to go in sales.
Well done.
Taking a step back in salary and everything. But who can argue the experience of being in front of you, the doctor, in trying to sell a technology that a marketer that has never been in front of the doctor would never understand the hurdles that he might face, or understanding your needs better. So think about the marketer that you've helped get that kind of experience and how better of a marketer he can be when he's now providing the tools for the sales force by having understood himself what it's like to be in their shoes. So putting yourself into other people's shoes, willingness to travel, mobility is key.
Sacrifice away from family.
Away from family. I think, the wife, the kids, they're your partners also. And so you got to bring them along. But that's the secret of having a diversified career. Diversity is great. We're in this industry, and do you see how things go from pharma to devices to drug delivery? It's a combination of pharma. So if you don't have a holistic view on all these approaches,
you're obsolete. And
you have not put yourself through managing these different types of products, then you cannot think in every single one of them equally.
Sure.
You're going to have a slanted mind or a preference for one or the other. You should not have that, because innovation is going to come in various forms, where only in a mind that has been trained to diversify, to take risks, to try different things, is going to be able to see how things can come and converge together.
Interesting, fascinating. Well, I always love seeing you, enjoying you, and seeing you. I hope your leg feels better.
Oh, thank you.
So you can go on the racetrack.
Exactly.
Very good. Thank you so much.
You.
We had a wonderful time with you at OIS.
Thank you very much. Great job here.